Hello everyone, I am Dr. Prajvit Rai. Today we are going to discuss about what prevents a normal vessel from blocking because of the vessel thrombosis. Now we know that whenever a vessel is damaged, it will undergo hemostasis, for which vasoconstriction, platelet plug and the fibrin clots are the very important factors. Now there are some mechanism in our body which will prevent these steps in normal blood vessels. Now what are they? Let us see one by one. So the first one is the endothelial nitric oxide and the prostacyclin. Now the endothelial cells will be secreting this nitric oxide and the prostacyclin on regular basis, so that whenever there is any platelet that is activated, it will deactivate them, it will prevent them from activation, and it will keep them deactivated. So there is no platelet plug formation because of this. Similarly, this nitric oxide will act on the vessel wall and lead to vasodilatation and prevent any vasoconstriction from happening. This prevents a clot formation. Now the one more mechanism is the protein C pathway. So in this, the normal endothelial cells will have these molecules called as thrombomodulin on the endothelial surface, which binds to thrombin and it will form a complex. Now this complex will activate protein C that is present in the plasma, and this will bind to the protein S along with calcium. This will inhibit the factor 5 and the factor 8. Now once the factor 5 and the factor 8 are blocked, there is no question of activating fibrin, so there is no fibrin formation. Now similarly, there is one more mechanism, that is antithrombin 3 pathway. What happens here? There is something called heparin sulfate which will be present on the endothelial surface, which will activate the antithrombin 3, which will block the factor 2, and similarly it will block the factor 10. Now along with this, it will block multiple other the factors of the coagulation cascade, and then it will prevent the fibrin from formation. So the antithrombin mainly blocks the factor 2 and factor 10, but it can also block the deactivate the other factors like 12, 11, 9 and 7 as well. So prevents the fibrin formation. So there is no fibrin formation, so there is no vessel thrombosis. So these are the few mechanisms in which the vessels, normal vessel will be prevented from undergoing thrombosis. Thank you everyone. Any doubt you can ask in the chat box.